For this week, we're going to talk about infection in the prostate. As you can imagine, infection in the prostate is named as prostatitis. Prostatitis can be developed into two categories. One group is called acute prostatitis. This is when an acute infection in the prostate resulting in severe pain on ejaculation, blood in your semen, and also sometimes high temperature. This is quite serious. It usually is as a result of immunocompromise, or somebody who had a biopsy of the prostate, or somebody who has an infection that creates an abscess in the prostate. And this can be incredibly painful, and non-treatment of this condition can result in sepsis. So acute prostatitis itself will require intravenous antibiotics, and oftentimes men has to be admitted to the hospital for several days for intravenous antibiotics. But on the contrary, chronic prostatitis is a condition that can happen in a less severe form. Chronic prostatitis can happen in a symptomatic manner and non-symptomatic manner. Non-symptomatic is when the prostatitis result in high PSA. The biopsy showed that there's inflammatory changes in the prostate, so it is not apparent to the person itself having no symptoms at all. However, chronic prostatitis, such as chronic bacterial prostatitis, it can be the bane of many men's life that can create in pelvic pain, difficulty in passing urine, frequent urination, painful ejaculation, and that comes on and off. It typically is triggered by dehydration. However, certain food such as spicy food or food rich in uric acid such as shellfish, and also nuts and beans, and also red meat can also trigger prostatitis, resulting in intermittent frequent urination, urgency and frequency. And chronic prostatitis, apart from needing antibiotics, sometimes will require medications such as alpha blockers, 5-alpha reductase inhibitors, and so anti-inflammatory. And all these will help to suppress the inflammation and result in improvement of the symptoms. And oftentimes this is coming on a recurrent basis, and it will need to be treated on a regular basis. For the new month of May, we're focusing on another form of infection, sometimes sexually transmitted, and then it is a form of infection caused by a virus called HPV. Then you need to stay tuned for next week's Putting Dr. G on the Spot.